So, and now I'm going back into the room here. We got an open mic, I think, somewhere along the line here. Where is it? Checking an open mic, and it's right there. Okay, got it. so, to continue talking about what's going on here, so we got to recognize, that this is that the symptoms of dry mouth, which is setting the stage for these stones, is you get a sticky feeling in the mouth. You get saliva that is stringy and thick. You get bad breath, difficulty chewing, difficulty speaking. It's called dysphagia, which is difficulty in swallowing, or dry or sore throat, and hoarseness, and dry or grooved tongue, and burning mouth syndrome. These are all the kinds of things that go along with this saliva, this recognized symptoms of dry mouth that includes all those factors. And the causes and risk factors of this salivary glands that don't make enough saliva and the dry mouth occurs. Recognized dry mouth causes and risks include medications for depression, medications for high blood pressure, anxiety, as well as antihistamines, decongestants, muscle relaxants, and pain relievers can cause dry mouth. And speaking a lot like I do. It's important to keep that mouth wet. Aging is associated with dry mouth, which may be due to certain medications. And Alzheimer's disease, inadequate nutrition, or other underlying health conditions. Aging and aging diseases. And chemotherapy drugs can change the amount and the nature of saliva that is produced. This may be a temporary side effect, or it may be permanent. And radiation therapy directed at the head and neck can damage salivary glands, like chemotherapy. The damage may be temporary, or it may be permanent. Radiation. Nerve damage as a result of an injury, trauma, or surgery can cause dry mouth. Diabetes can cause xerostomina symptoms, which is the medical term for dry mouth, is actually a symptom of undetected or unmanaged diabetes. Stroke can cause dry mouth, and dependent upon the type of the stroke and the severity, the symptoms may be permanent. Oral thrush, a yeast infection in the mouth, can cause dry mouth and dry mouth symptoms, and it's often resolved when the infection is treated. Alzheimer's disease is related to xerostomina, and the Alzheimer's Association indicates that it may be caused by the inadequate fluid intake in addition to certain prescribed medications. In other words, people aren't drinking enough water, and then they're taking these medications, and it's devastating. Sjogren's syndrome is an autoimmune disease that causes excessive dryness in the eyes and mouth, as well as other conditions. So it could be Sjogren's syndrome. And HIV, AIDS, causes dry mouth for many people. And HIV-associated salivary disease is common in diagnosed children. In addition, with many of the medications prescribed for HIV/AIDS are linked to dry mouth syndrome. And tobacco, the use of tobacco, smoking, and chewing can cause dry mouth. Quitting smoking relieves symptoms very quickly for some. And alcohol use, including binge drinking and the use of alcohol-based mouthwashes, can cause xerostomia. Now, recreational drug use, particularly the use of methamphetamines, can cause severe dry mouth, commonly referred to as meth mouth. Marijuana use can also provoke symptoms when smoked or vaped. In addition, the American Dental Association identified the following more rare causes of xerostomia in a report to the ADA Council in Scientific Affairs, which included graft versus host disease, immunoglobulin G4 sclerosing disease, degenerative disease amyloidosis, granulomatosis disease, and sarcoidosis, hepatitis C, salivary gland aplasia or agenesis, lymphoma. Conventional treatment, many people ignore dry mouth symptoms and don't visit their doctor or dentist as they see it to be just an uncomfortable condition. However, left untreated, serious dental health conditions and poor digestion can occur. Diagnosis requires a full review of your medical history, including any medications you are taking, any past physical traumas to the head or neck, and any history of chemotherapy and radiation for cancer. Your physician will likely order blood tests and imaging scans of the salivary glands to look for the root cause. If Sojourn's syndrome is suspected, a biopsy may be taken to confirm the diagnosis, as dry mouth syndrome can cause serious dental health problems. It is important that your dentist be included in the treatment. Ideally, you should visit your dentist every 3 to 6 months, according to the American Dental Association. Conventional treatment for xerostomia depends on the root cause. Finding an effective treatment to manage diabetes, for example, may be the first step if that is determined to be the cause. Your medical team may recommend other treatments such as over-the-counter oral rinse and mouthwash, like that, or like a mouthwash that is totally natural that's listed under teeth, under common conditions, under teeth in the herbalhealthreview.com website. You'll find a oral health care liquid that will replace toothpaste and be better than anything you've ever found to strengthen and toughen the gums, harden the enamel of the tooth, harden the entire tooth from the ingredients in that oral care refresh, brush and rinse on the website herbalhealthreview.com under common conditions under teeth. Teeth. T-H-E, oh my goodness, teeth. T-E-E-T-H, teeth. Sometimes. And, and, um, and the other thing that they will prescribe, medications to stimulate saliva production. But there are herbs that will stimulate saliva production, which will be better than the medications. Because the medications are things like pilocarpine, needs to be used carefully according to Harvard Medical School. This is a powerful drug normally used in the treatment of glaucoma, and it may help to relieve dry mouth, but it carries worrisome side effects, including limiting night vision and chronic inflammation of the eyes. And then there's fluoride trays worn overnight to prevent cavities that'll dumb you down, and you won't care what's happening to you, because the fluoride is what the Nazis used to dumb down the Jews before they would send them to the showers and kill them. They use fluoride. And of course, that's still the evil thing that the dental industry does. And even you'll probably still find it in some water supplies, that the government is, your local state government is very happy to put all these poisons in your water supply, like fluoride, to dumb you down, so you're more compliant, so that you'll take more of their drugs and ignore more of their political evil things they do. So here's what we need to do about this. The 9 natural treatments for dry mouth. Stay hydrated. Keep sipping on water. And throughout the day, keep your mouth moist by drinking a minimum of 10 8-ounce glasses of water. That's 80 ounces of water. What you really want to drink is half your body weight. If you weigh 200 pounds, you need 100 ounces of water. If you weigh 50 pounds, you need 25 ounces of water a day. But if you weigh 200 pounds, you need half your body weight in ounces of water every day. And you can count quality liquids like soup, not too much sugary fruit. We can't count that. But a little bit, yes. Modest amount of quality liquids, but mainly water. Anyway, you want to drink with meals. I know you've been told, do not drink with meals. Drink with meals to help with chewing and swallowing. Drink non-alcoholic beverages with meals, and take small bites, and sip your drink as necessarily to aid in the breakdown of the food. Take digestive enzymes, especially hydrochloric acid, betaine hydrochloric acid. It'll talk about the proper enzymes in the Make Lifestyle Changes report on herbalhealthreview.com. Yes, drink with meals. And moisten foods with broth. Let's get more soups, more soups with more liquid with your foods. Avoid dry foods like crackers and other foods that suck up the little moisture that you have in your mouth. And add bone broth to help moisten drier foods. Bone broth. That's right. That's going to really help a lot of things. A lot of things. Bone broth in your diet is going to help a lot of things. And I mean, you can if you're making chicken soup, put some beef bone broth in your chicken soup. If you're making fish, put some beef bone broth and create a little bit of a liquid in a broth in with your fish. That bone broth will help moisten drier foods and make it easier to chew, swallow, and digest. It's also important to avoid salty processed foods like potato chips and other snacks, as they can make symptoms worse. Breathe through your nose, not your mouth. Do not be a mouth breather. Be a nose breather. Train yourself to keep those sinuses clear and clean and breathable. Because for two reasons. Because if you don't breathe through your nose, that moisture is going to build up, and then you're going to have sinus infections, and that's no fun at all. Sinus infections in the nose because you're not keeping it clean. You're not blowing it, and blow it gently. You don't have to blow it so hard you hurt your ears. Avoid blowing it with pressure on the ears. Just clear it. Clear the sinuses. And if you need help doing that, there is a sinus rinse. You can rinse the sinuses and get rid of sinus infections with a sinus rinse herbal formulation that is called number 1033. Number 1033. It's an herbal tincture extract that you can put the drops directly into the nose, a few at a time, or you can put them in a neti pot that you get from a health food store. So, yes, breathe through your nose, and because when you're exercising, limit through your mouth as much as possible, and sip water throughout your workout. And if you snore, try natural snoring remedies to help keep your mouth moist. Use a humidifier. That's right. Use a humidifier and put some colloidal silver water in that humidifier, because it will also get rid of any fungus, virus, bacteria that might build up in a humidifier. It'll sterilize it, and when you get that colloidal silver water in the air and breathe it, it will get rid of pneumonia in 24 to 48 hours breathing colloidal silver water. It will clear the sinuses of any sinus infection by breathing the colloidal silver water in a humidifier. So it's learning these kinds of things, using a diffuser and putting some essential oils in there like eucalyptus. The electric horseman with with the horse in there that he gave the eucalyptus oil, and he had the horse breathing vapors of eucalyptus oil to get rid of a sinus infection, and a lung infection in the horse. So, and he didn't even know about colloidal silver water, but anyway, colloidal silver water, incredible. Essential oils, breathing them, they'll do incredible things. They'll also help you to sleep. And use coconut oil on your lips. And dry and cracked lips are common with dry mouth. And coconut oil on your lips several times a day is excellent. You can try something called coconut oil pulling, which you'll find in the teeth report under common conditions on herbalhealthreview.com. It'll talk about coconut oil pulling, where you can treat many of the symptoms of dry mouth, including bad breath and tooth decay. A number of studies have shown that this traditional Ayurvedic practice can improve overall oral health and decrease the microorganisms that cause bad breath. Also, one study points to the lauric acid in coconut oil helping to decrease plaque. When practicing oil pulling, remember not to spit the oil down the drain. Instead, spit it out into the trash can. Eat saliva producing foods. Saliva producing foods, like organic apples, cucumbers. Whenever your mouth feels dry, their high water content can help to relieve symptoms. In addition, adding fibrous foods that require a lot of chewing, like raw carrots, can spur the saliva production. Certain herbs and spices, including cayenne pepper, fennel, ginger, and even endive, E-N-D-I-V-E, endive, have been shown to increase saliva. Add them to your diet whenever possible. Practice good dental hygiene. Read the teeth report on herbalhealthreview.com and use and floss and use mouthwash and brush at least twice a day. A joint study from the researchers of Stanford University School of Medicine and Kyoto University School of Medicine and the public health found that toothbrushing should be encouraged, particularly for those taking certain medications, as dry mouth in elderly can lead to pneumonia. Use only alcohol-free mouthwashes like the one on herbalhealthreview.com under common conditions, under teeth. Because you use only alcohol-free mouthwashes, and as alcohol dries the mouth. And so effective natural mouthwashes are available. Plus, you can try, the homemade mouthwash recipe that you're going to find, again, on herbalhealthreview.com under common conditions down in the teeth report. Precautions: when dry mouth symptoms persist, they can cause poor oral health. Conditions like gum disease and tooth decay. In addition, without adequate saliva to combat bacteria and fungi, infections including oral thrush are possible. As digestion begins in the mouth, if salivary glands aren't producing enough saliva to properly break down lots of starches, then poor digestion can occur. In elderly, dry mouth is a great concern as it makes chewing, swallowing, and digestion difficult. And this can lead to poor nutritional deficiencies and even pneumonia. Key points about dry mouth. Dry mouth, or xerostomia, happens when the salivary glands do not produce enough saliva to keep the mouth moist. Aging, certain medications, cancer treatments, and underlying health concerns, including certain autoimmune diseases, can cause dry mouth. Conventional treatment depends on the underlying cause of the xerostomia. Changing medications and treating diseases like diabetes may help. There are prescription medications available that may spur saliva production, but they may cause severe side effects and must be used with caution. Natural treatments to help prevent tooth decay and dental problems, as well as ways to keep the mouth moist, may help relieve dry mouth. So again, stay hydrated. Drink with meals. Moisten your food with broth. Breathe through your nose and your mouth. Use a humidifier. Use coconut oil on your lips, and even coconut oil pulling, and eat saliva producing foods. Again, apples, cucumbers, carrots, cayenne pepper, fennel, ginger, and endive are some of the foods that spurs saliva production. Practice good dental hygiene, and is all about that's all about how to stop the stones from occurring. Once you know that you have a stone, we go over here to common conditions. And when we're at common conditions, we go down to the kidney bladder report because it talks about stones and how to get rid of stones. So let's take a look at how it's done and the herbs that break down stones in the body. And there they are under kidney bladder. I'm on my way, and we're going to take a look at herbs that break down stones anywhere in the body. We're on our way, and we're in the kidney bladder report on herbalhealthreview.com. Under common conditions, we've gone down to the kidney bladder report. And now in the kidney bladder report, it's talking about the kidneys and how to deal with stones. One of the things that breaks down stones in the body is marshmallow root tea. And the herbs, this tea, let's talk about this marshmallow root tea. If you have stones anywhere in the body, then you drink this tea, you hold it in your mouth, and you're drinking a quart of it a day. You make a fresh quart of marshmallow root tea every morning, and you drink it throughout the day, and you're done 2 to 3 hours before bed, because we don't want to load up on fluids, then go to bed, because then you have to get up before before long, you're up having to void your urine. And so let's slow down on the drinking. Let's drink plenty up to 2 to 3 hours before bed. But 2 to 3 hours before bed, let's slow down on the drinking and have consumed half your body weight in liquids throughout the day, including that 1 quart of marshmallow root tea. So what you do in the morning is you get a pan and you fill it 1 quart full of water. It can be reverse osmosis water. It can be distilled water, or it can be water with minerals in it. And you bring it to a boil. You pull it off the burner. You put a tablespoon of marshmallow root tea in that pan of water, stir it up a little bit, cover it with a lid, and let it cool down. Then sip on it throughout the day. That is going to coat over any stones anywhere in the body, and it's going to help them slide out of the body, and it's going to help to break them down. Now, especially when you know about the concentrated herbal tincture extract that helps get into the harder places and break down those stones. And that would include a kidney bladder herbal tincture that is made with peach bark, marshmallow root, buchu leaf, corn silk, echinacea, goldenrod, parsley root, red clover blossoms, dandelion root, and watermelon seed, and uva ursi. That is a tincture that breaks down stones, and especially in the urinary tract. But it's also effective in the salivary glands. Then if you're using Schizandra berry. Schizandra berry, 30 drops 3 times a day. That's going to strengthen the digestive organs and the immune system, and it protects against free radical damage and viral and bacterial infections. So that's why we would use Schizandra berry. Then, if we had inflammation, we're going to add extra nettle leaf because it reduces inflammation even in the salivary glands and in the urinary tract. If we need more help with those stones, we are going to look at a herbal product called, it's an herbal tincture extract. Its name is Stones Clear. Its product number is 1399, 1399. Its name, Stones Clear. It has an herb in it called hydrangea root. That is the herb that will break down stones anywhere in the body. Then, so will gravel root. And then we've added then marshmallow root, some goldenrod leaf, and structured water, and 20% alcohol. Or, if we've got dry mouth, we can get it as a non-alcohol tincture. All you have to do is ask for it. It would be number 1399, alcohol free. And then you would have no alcohol. And it's the hydrangea and the gravel root that is going to specifically work on the stones in the mouth, in the salivary glands. So that is the answer to your question. And I'm going back over to area code 917. Did you get that? Area code 917. Did that?
Yes, Dr. Truman. Yes,
got,
I did.
Okay.
I did. I wrote it down, and I also brought up the health review online. So yes, I did. Thank you very much.
You're welcome. Did you have any other question?
No, that will be all. That will be all. I've gotten a lot of information today. So yeah, there's a lot to work with.
Okay, great.
Yeah. So
right.
thank you for addressing it.
Thank you for your contribution. Okay, folks, that leaves a line open for you if you have a question, a comment, or a suggestion. In the meantime, while I'm looking for somebody to open their mic and make a suggestion or a comment, I'm going to and go ahead over there in Georgetown, Texas. Your mic is open. What is your question or comment? Hello, Tony. Hello, Tony. Oh, I guess it just accidentally came open. Oh. Okay, I'm closing the mic again. Okay. That leaves us with a couple of topics here that were brought up. One of them is hiatal hernia. Let's take a look at what natural remedy doctors know about hiatal hernia. Okay, that was a lot of information there about stones. Now, hiatal hernia. Hiatal, Hernia. Now, let's see what he knows about this. And I'll take a sip of tea. All right. And so, hiatal hernia. Let's give you some remedies for hiatal hernia. The different types of hernias develop inside parts of the body, causing an abnormal bulging of one area into another. A hiatal hernia, also known as a hiatus hernia, forms inside the diaphragm, the muscular area that lays between the chest and the lower abdomen. It's the most common diaphragmatic hernia, with the prevalence rate of hiatal hernia is between 3% to 60% of all adults. This includes roughly half of those over the age of 50. However, many people with a hiatal hernia have no idea because they never experience noticeable symptoms. The abdomen holds most of the most important organs of the digestive system. These include the lower part of the esophagus, stomach, small intestine, colon, rectum, liver, gallbladder, pancreas, spleen, kidneys, and bladder. And when the abdomen experiences injury, lots of pressure, straining, or inflammation, then any of these organs can dysfunction. Middle to older aged women over 50 years old develop hiatal hernias more than any other group. The risk only goes up if the woman is overweight, obese, ill, due to if they're ill and due to another disease, or pregnant, according to the Cleveland Clinic. So then the risk goes up. If you talk to your doctor about symptoms of heartburn, anemia, acid reflux, or GERD, he or she might have recommended that you should be checked for a hiatal hernia. All of these conditions are related and develop due to similar causes. These causes include eating a poor diet, being overweight, obese, taking certain medications, or high levels of inflammation. So what is a hiatal hernia? A hiatal hernia is when a part of the stomach pushes into the chest through an opening called the hiatus. The hiatus is a part of the digestive system that connects the stomach to the esophagus, also called the food pipe. Officially, there are 4 types of hiatal hernias. Type 1, the most common, occurs when there is a widening of the muscular hiatal tunnel and the circumferential laxity of the esophageal membrane, allowing a portion of the gastric cardia to herniate upwards. That's type 1. Types 2 and 3 and 4 also involve esophageal membrane and account for 5% to 15% of all hiatal hernias. Type 2 results from a defect in the esophageal membrane. Type 3 have elements of both type 1 and type 2 and type 4, and results from a large defect in the esophageal membrane. While a hiatal hernia sounds like a pretty painful condition, given that the stomach pushes through an opening in the diaphragm into the chest, most people with one don't even notice any symptoms. When symptoms do occur, they include heartburn, acid reflux symptoms, or developing a more severe digestive problem called gastroesophageal reflux disease, or GERD, GERD for short. Around 20% of all adults experience these symptoms on a regular basis, some almost daily, while many people with hiatal hernia suffer from symptoms of heartburn, acid reflux. The hernia doesn't seem to directly cause these conditions. Instead, whatever factors contribute to the acid reflux, poor diet, inflammation, etc., also contribute to the hernias. Having a hiatal hernia isn't a guarantee of developing acid reflux or GERD, but however, some people have one condition without having the other. But research shows there is often overlap between the two. Additionally, hiatal hernia is common among those with Crohn's disease. Now, common symptoms of hiatal hernia. Well, if someone develops the signs and symptoms of hiatal hernia, usually it includes chest pain, burning sensations, and irritation of the throat, and other symptoms related to acid reflux, heartburn, and GERD are also possible. Symptoms associated with acid reflux include heartburn, bitter taste in your mouth, periodically, or for some people throughout the day. Some people taste regurgitated food or sour liquid at the back of their mouth or throats. Waking up feeling like you're choking or coughing in the middle of the night. Dry mouth, gum irritation, including tenderness and bleeding, bad breath, regurgitation of acidic foods, bloating after meals and during bouts of symptoms, nausea. More severe symptoms can include bloody vomiting, possible sign of damage in the lining of the esophagus, or you might have black stools. There might be belching, gassiness, burping, flatulence after meals, hiccups that are difficult to stop, difficulty swallowing, possible sign of narrowing esophagus, unexpected weight loss, discomfort that worsens when bending over or laying down, hoarseness upon rising or throughout the day, chronic coughing or throat irritation, throat soreness and dryness. In severe cases, GERD may lead to bleeding ulcers in the esophagus. It can also lead to a dangerous condition called Barrett's esophagus, which can lead to esophageal cancer. What is a hiatal hernia? Well, heartburn, bitter taste in your mouth, waking up feeling you're choking or coughing in the middle of the night, dry mouth, gum irritation, including tenderness and bleeding, bad breath, regurgitation of acidic foods, bloating after meals, during bouts of symptoms, nausea, and more severe symptoms, bloody vomit or black stools, belching or gassiness, burping, and flatulence after meals. So these are all the things that we went through. There's all kinds of different types. There's a sliding hiatal hernia, and there's paraesophageal hiatal hernia. There's type 3 hiatal hernias and type 4 hiatal hernias. There's all types of these hiatal hernias. And so the big problem is high levels of inflammation and poor gut health and poor eating and poor diet and obesity and overweight and chronic strong coughing. So these complications like heartburn, acid reflux and GERD, stomach bleeding, ulcerations. So people are antacids and H2 blockers or use of other medications are commonly used to manage symptoms of heartburn and acid reflux, and some lower acid production while others block acid's effects or help clear stomach acids quicker. And so there's all kind of medications that are out there, which you want to get away from as quickly as possible. It's mainly what you need is lifestyle changes. You need to get into that Make Lifestyle Changes report. Improving your diet, losing weight, being more active, managing stress, changing medications, and getting off of these drugs. And if needed, and changing your sleeping position, and all of these kinds of things. But because in severe cases, there's hernia surgery that people are going through, which cuts off the blood flow to the stomach. They call it laparoscopic surgery. Is one of the most common surgical methods used for fixing hernias. The surgeon only makes small incisions to perform a laparoscopic surgery using a laparoscope. The risk is believed to be relatively low for lots of scarring and complications during recovery.